Human Services Committee to order. Do we have any corrections to the minutes of last meeting? Okay, seeing none, the minutes are approved. Today we'll be taking our agenda out of order. If it's okay, Dr. Anderson, I'd like to welcome you to the table first. And we'll talk about an IMA with SUNY Upstate.
Thank you. Nice to see everybody. So we're here today to ask for authorization to enter into something called an academic health department with SUNY Upstate. And I'll clarify what that means before I go into some of the details of it. The goal is not to establish a new department of anything, but this is a technical framework that exists actually across the country with several very impactful examples of where local health departments or state health departments work together with academic teaching hospitals and universities to strengthen local preparedness, to increase the public health workforce, and to just streamline opportunities to collaborate. So we're seeking to formalize this relationship with SUNY Upstate, but it's building on a lot of ways that the health department and SUNY Upstate already work closely together. There's a few examples in here in the memorandum, but for example, we're working with Upstate actively now on back-to-school immunization campaigns with UPAC. We work closely with them in terms of children who are found to have EBL, working with their physicians in terms of them being treated in the hospital. DCFS within the counties working with UPAC in foster care. Our substance use team, I'll just keep going through these examples so you get a sense of the many different ways that we already work with them and how a formalized system could make this a little more streamlined. Our substance use team is working with the emergency room physicians at Upstate to provide peer services to people in the emergency rooms. We have medical directors who we contract with as experts in sexually transmitted infections, tuberculosis, refugee health, who already engage with our various programs and provide expert support and guidance. We also have, in the academic area, many examples where we engage pathology fellows and residents, for example, to train with the medical examiner's office. We have MPH students who engage with us. So a goal is to take all of these existing areas where we work together with a lot of additional potential for areas that we could work together and formalize the structure by having an advisory board that would involve representatives from both parties that would meet twice a year, that would help us be more prepared locally to pivot and work together quickly in terms of things like data sharing agreements, ways that we may exchange people, exchange resources. So the discussion today is not to ask for any funds, to commit any other resources, but to ask for permission to enter into this agreement with them, for which the key terms have already been laid out.
Formalization of relationships that pretty much exist.
And
expanding on them.
Yes.
Any other counties in the state do this?
There's one example of a very formalized relationship in the University of Albany and the New York State Department of Health. So they have a very close relationship where there's PhD students, for example, from the School of Public Health who train in the department. There's a lot of retention of local talent. There's a lot of really high impact public health research that comes out of that relationship. Monroe County and the University of Rochester also have a very close relationship. I don't know if they formally call it an academic health department, but they're another strong example.
That's what I was thinking of, that U of R.
Yep.
Strong.
I think this is a great example of being able to streamline services between both entities, and obviously we have several examples of really beneficial programs in front of us, but this is something that we might not even know the level of impact that we could see in 2 years, 5 years, 10 years down the road. One question I obviously need to ask about, I think I saw in the previous packet, there was a mention of early intervention that doesn't appear to be in the next one. I just wondered what the story was there.
Yeah, and I should mention Linda Veep joined us, Assistant Vice President for Community Relations from Upstate. Thank you for being here to represent. We would certainly explore opportunities to partner with College of Health Professions, colleges across upstate. That one would just be more of a startup, but that's the intention of this, is to identify those opportunities.
I know there are examples like at Syracuse University where they have student-run speech clinics, for example, and there's some of that work being done with the upstate physical therapy program as well. They're experiencing some turnover in their staff, but I think that would be a great opportunity going forward because we know where the needs are with a lot of kids waiting for services, obviously, and that might be a nice way to meet those children with the services that they need.
I think that's a great point. And I think a goal of this would be to increase the amount of exposure that local folks who are experts in these different things, physical therapy, medicine, public health, to get exposure to what local public health looks like, what early intervention looks like, and hopefully get them interested and retained.
Yeah, and just being able to share data between both parties would be a tremendous support for all the work that we're doing in the county and likewise with upstate as well. Legislator Meeker?
Thank you. So at this point, the relationship exists already between the county and upstate, correct? So is it fair to say that the biggest reason for this to happen is to share information?
It's one of the goals. So when we look at what these types of agreements look like in other places, and there's actually a really nice website for academic health departments where there's examples of MOUs and things like that. There's typically one that sets up the collaboration framework, like the presence of an advisory board. It may or may not include data sharing details. How would we share data between the two? And then there can be separate agreements for things like how would we handle trainees, how would we handle research, anything that involves transfer of funds may require additional approval and review. The benefit of this particular, the particular details that are laid out in the memo and that we would seek to formalize in an MOU are that establishing a set group and an intention where there are going to be people from both parties who get together at least twice a year and talk about how are things going, where could we expand this, and start to think of things that we may not even have on our radar but could be beneficial to implement in real time, will be helpful. And then to think about some of those processes where currently we have separate agreements with all of these different individuals. Some of them may still remain, or these individual activities. But thinking about things like data sharing, there may be system-wide things that we could think about and start to formalize. So it cements this relationship together and thinks about the cross-cutting themes that we could start to kind of streamline, and then just sets this process in motion where it's now an entity that exists and there's accountability and check-ins to kind of keep things moving along and growing.
Okay, so at this point then it's really more about just sharing not so much data, but sharing information in the long term, possibly to share data.
I think that there are going to be many different flavors of data that we may wish to share down the road with no intention of receiving, routinely receiving identifiable patient information, for example, or sharing that. But there are specific details that will have to be worked out on the data sharing. I'm not sure if that will end up being specifically part of this MOU. I suspect that may be a down the road discussion in terms of all the different types of data sharing that may occur.
Understood, thank you.
Yeah.
And just a couple points that I appreciated from the memorandum as well is that to be clear that this does not bind us in any way financially, so any expenditures would come back to this body. And likewise, any expenditures from upstate would require approval on their part. And I'm also appreciative that we would expect regular reports of activities with the academic health department, as well as just regular updates on the work that they're doing. So, Legislator Bush?
Where do our other health providers like St. Joe's and Kraus fit into this kind of relationship?
They would not strictly be part of the academic health department relationship.
Okay.
That said, it wouldn't preclude us, and we would certainly want to continue to be collaborating with Syracuse University is another example that comes to mind, where there's key community partners that wouldn't be excluded by something like this.
Okay.
It wouldn't involve that relationship, but there's certainly key partners who we're working with together on actually a lot of these same types of initiatives.
So that's crucial in
Absolutely.
a community like this.
Absolutely.
Make a motion.
Okay, I have a motion from Legislator McCarron. Do I have a second? Legislator Meeker, all in favor? Aye. Okay, motion is approved.
Thanks for your support.
Thank you.
Thank you.
All right, moving along, we will proceed with Deputy County Executive Ann Rooney for a brief update on a program we've been working on.
And I'll do the other one.
Sure, first.
We won't leave you in the lurch. Good afternoon, everybody. Just wanted to brief everyone. We are in the process of applying for a New York State grant from the New York State Dormitory Authority. They put out this solicitation a couple months ago. It is due August 15th. I'm sure you have all read about what has transpired over in the East Adams Street neighborhood with the Children Rising Center that was proposed, and there was a lack of site control for that process to move forward. I want to say 2 years ago, the county executive in his budget committed $5 million to that project, and that money is still sitting in a grant account. When the Children Rising plans that we've been working very closely with the Allen Foundation, the Early Childhood Alliance, Blueprint 15 to put all of that together, it really was a lost opportunity. At the same time, West Hill School District purchased the St. Anne's property that sits adjacent right on Onondaga Boulevard, which is right outside the 13204 zip code, which is one of our most economically challenged zip codes in the county. We have been working with West Hill about possible uses for that St. Anne's complex because it has what used to be a church, a full school, and a gymnasium, sitting with plenty of parking and on a central bus line. And so we put the two together when the Dormitory Authority came out with this solicitation, that perhaps this is an opportunity for us to get St. Anne's renovated, take some of the components that were intended for the Children Rising Center and move them into St. Anne's. It's unique for West Hill because they purchased this property that it can only be leased to, because it's owned by a school district, it can only be leased to another governmental entity or another, for a school purpose. So that clearly limits who they can partner with for the rehabilitation and renovation of the site. So with that, Katie Anderson can tell you, we have been working day and night to try to put this together, and the timing of it is such that the grant is due August 15th. We have to have site control in order to apply for the grant. That's where all of you come in. Normally, the legislature doesn't get involved when we're applying for grants, other than to accept the grant awards when we're successful. This one is a little bit different because we have to establish site control. In order to do that, we will have to have a signed lease with West Hill by the date of submission of August 15th. If we do not get the grant, the lease will go away. So what I will be, and I asked Legislator Kelly if I could come and brief you, it will go to Ways and Means, but the timing has just been figuring out which of the parameters and making sure we are checking off all the boxes. This is one of the big ones. And so just to give you that briefing, we will be applying, there's 3 different stratas you can apply for. A 1 to 5 million is most likely where we will, with a 20% match from the county. We will be able to use the monies that are sitting in the Children Rising Center account. Some of the things that we're anticipating having in there are like the play space that they had anticipated over at Children Rising. A lot of activities around early intervention services, family services, but also potentially on our adult side, having it be a feeding site, possibly using the old kitchen and turning that into workforce development activities with one of our human service partners. And lastly, tying in the high school. We have really successful programs at both CNS and West Genesee where they have a drop-in center adjacent to their high schools for students in the school. And we would look to do that same model in the St. Anne's property because it is literally right next door. So I wanted to give you that briefing. Some of the good news, if we are successful, we've already negotiated a base rent with St. Anne's. All they want to do is cover their carrying costs, which are about $60,000 a year, which if you were to drive by and see the expansiveness of the space, it is a pretty good deal. And this is strictly a bricks and mortar application that it's the New York State Dormitory Authority. So it will be renovating the complex, plumbing, maybe air conditioning, electrical, all those things, flooring, but then making it windows, making it accommodating to a lot of little children being able to be served there, but also families and seniors. So this will be coming to Ways and Means, but I just wanted to take the opportunity to brief this committee because many of the activities certainly will come back and be associated with all of you.
Not to get ahead of ourselves, but is there a timeline on the grant reward?
They said November.
November?
Yes, so we submit in August. And we will be going to the West Hill School Board, August 4th. We'll be approving the lease and then come to you on the August 5th for the ability for the county executive to enter into the lease with West Hill. Did I get it right, Ben?
Unless, I want to get ahead, I think, it might, depending on our legislative schedule, they might go after you guys, depending on the session.
They are the 4th and we're the 5th, isn't that right?
Currently with the 5th, as I mentioned, there might be plans to,
Okay.
want to get ahead.
So I just wanted to brief all of you so you weren't surprised by all of this when it goes to Ways and Means.
Sounds like an excellent opportunity. Thank you for the update.
I do have a question. The demographics and the geographic location of the population you hope to serve, where would that be?
So if you were to go out to Auburn and you were to have, go to the play space there, it serves all of Auburn,
Right. I'm
it's
familiar with that.
yes, so that would be similar, but the location that we're primarily focused on is the folks who, they shop at Western Lights, they do a lot of things at Western Lights out of that 13204 zip code, so it's basically about a half mile down the road on the same main thoroughfare. So it would be open to everybody, and then for early intervention services that we would, push in staff, OT, PT, speech, those children can come from anywhere in the county. For a senior dining site, it would be primarily focused, on the neighborhood that is there.
Because it seems like it's not anywhere near where the original intent was to serve a community.
Yes, 100% agree. The thing that made this so unique is the fact that a school district owns the property.
Right.
It is, all intents and purposes, it is not in bad shape. We've been through it now many times and has a lot of the pieces that were going to be built over here that we are not seeing how this can be accomplished based on the lack of site control that is in existence over here in the East Adams neighborhood. Doesn't mean that down the road we wouldn't look at something else if it were to come to pass, but we thought this would be a huge missed opportunity if we didn't at least submit our application for
But
this.
it must be a little disappointing to the people that
No.
promoted this, that it's not in the community that they hope to serve.
I think it's disappointing to everybody,
No.
that this isn't, whether the YMCA, all of the pieces that were
Right.
there, absolutely.
Right.
This isn't precluding us from participating if they're able to resurrect that.
I'm glad to see the county stepping up. There's an obvious need for a facility like this, and this independent group that was trying to get it done failed significantly, and I'm glad to see the county government recognizing a need for this and stepping in to do what we can do in the interim.
Thank you. This is a wonderful, if you want to call it that, it's a consolation prize, right? It's a really good one though, right?
Yeah.
I mean, obviously what everyone wanted was option A, but option B is a pretty darn good one. And really a location that is going to serve the people that need it as well.
Mm-hmm.
So I think it's wonderful. I hope that the grant goes through. My only question would be in regards to the lease as to when you submit the grant, they're okay with, if you don't get the grant, then the lease is null and void?
I think it would, and I'll ask Ben, but I think it would be a side agreement.
100%. The way the lease is being drafted it would be effective upon grant funding, and it would disappear upon grant funding. The lease would terminate at that point. It's basically all, a better way to say it's contingent on receipt of grant.
Can I get a little bit more detail on what the uses of the building is supposed to be for? Is it more than what you just said?
as far as what the intended uses.
Yeah.
So if there's a church building, the former church, all the pews have been removed. That's the intended where the play space will be, which would be smaller in size, but the Children Rising Center was intended for a play space. There'll be that inside part, and then also adjacent to the front of the building is an area to have an outdoor play space as well. So if you were to go, and this is largely modeled what they already have out in Auburn, New York, they have an indoor and an outdoor space. Then there are a multitude of classrooms that are unoccupied at this point, and there would be various activities. So in the play space, we could see pushing in both all early intervention services, but then also the opportunity for some of those classrooms to possibly have a vendor working in there providing those services regarding early intervention. The other thing that we are looking at on the adult side is because there is also a big cafeteria and a big commercial kitchen, to having a senior dining site there, but also a vendor who does a lot of meal preparation in the community, has a potential interest in using the kitchen for that purpose. I can't name any of these because they are, they're in the midst of all of this with us. And the last part is a teen, and this really is associated with West Hill High School because of it being adjacent, that students could walk over, similar to the model that we've seen in other schools.
So I got a follow-up question, since it has to do with, small children. What about I wonder if you could come back and talk about the daycare situation to this committee meeting in the future, because.
I think I'm planning to come to the caucus on Tuesday.
Okay, and we will move on if nobody has any other
Thank you.
questions to
Thank you.
item number 1.
Now I need my glasses. Yes, so this is for an appointment to the Environmental Health Council, Jeremy Udo. And this council, and this has kind of gone back between our environmental health staff in the health department, and then we have our Office of the Environment. And so they work in concert to fill the spots on this board. And this is one that Dan Kranz is here, our new Director of Intergovernmental Relations, and he's been charged with filling the board appointments that are vacant. And this board certainly is one of those that has a number of vacancies. And so this is to move the appointment forward of Mr. Udo, who has a he's an attorney, mechanical engineer, gone to school more than maybe even Dr. Anderson. But this would be to start the process of filling that board and reconstituting the purpose of that board. And I think his resume speaks for himself, has a lot of history in the utility industry tied to the environment.
I think it's great that we've made a real effort to fill these boards and recognize the important work that they do, so I appreciate that. It is the county executive's appointment.
Yes.
Do we have any discussion?
I'll move it.
Okay, we have a motion from Legislator Meeker, second from Legislator Harvey. All in favor? Aye. Okay, motion is approved. And with that, thanks everyone for coming. We are adjourned.
Good. Oh, great.